Everybody, and welcome to NENIC's Fall Education Program. We're very pleased to have Matthew Butler here to do our session this evening. Matthew is the Director of Artificial Intelligence at Brown University Health. In his role, he leads strategy development for AI, which includes establishing the Brown University Health's first AI Center of Excellence. Before joining Brown, he held leadership positions in healthcare and technology at companies like Accenture and Mass General Brigham. His key initiatives are to lead AI strategy development and establish the first AI Center of Excellence for Brown University. And we're we're very happy to have you here tonight, Matthew. Thank you so much for joining us.
Oh, thank you so much for having me. And I just want to thank Sue Whetstone too for offering this opportunity to come and address you all. It's an honor to be here and really excited to talk about AI and what we're doing at Brown Health and really how we're trying to lay the responsible foundation for the entire organization, but also I'll highlight ways that we're trying to position it for nursing and nursing informatics as well. So thank you so much for having me. Today, we're going to walk through a number of different elements of AI from strategy all the way through enablement and application. There'll be examples along the way. I'll do a quick demo for you too, so you can see some of the tools in action. Please, if you have questions along the way, feel free to come off mute and ask. Put them in the chat. I'll do my best to monitor. And also, there'll be time at the end to go through any of the Q&A as well. So thank you for having me. Really excited, and we can dive right in. Can everybody see my screen? And does it? Perfect. Okay. So, hi, everybody. Matt Butler. I'm the Director of AI for Brown University Health. I have been working in healthcare my entire life. I grew up in the post-acute space, working in assisted livings and skilled nursing facilities. I did consulting with Accenture for big Epic implementations across the state of Massachusetts. I worked at Mass General Brigham, where I focused on population health and value-based care and emerging technology and innovation, and then led a lot of the AI enablement for the organization, and recently joined Brown Health to really start the AI Center of Excellence and form a cohesive strategy across the organization for how we can potentially leverage AI to transform the care we provide our patients. This is just a level setting slide. So healthcare is really hard right now. It's been hard for a number of different years, really since COVID, probably before then. There's always been financial pressure, but that is being felt more acutely today than ever. Access challenges across the board. We are really struggling in the state of Rhode Island with primary care access. And I know that is acute and acutely felt across New England. We also have workforce shortages, which are from really burnout from our providers, our care teams, our nurses across the board. People are leaving because it is just such trying times. And we need help in healthcare to be able to right the ship and hopefully be able to get to a space where we can get back to what matters most, which is the human connection that we have with our patients. And really, AI offers a lifeline in a lot of ways to be able to start addressing some of the challenges that we're facing across the board. So just to level set, AI in healthcare can be a catch-all term. AI in its most infant stages is really rule-based systems, which are if a patient shows up to the ED and they have a sore throat and a cough and a runny nose, we'll screen them for COVID. So really if-then statements. Then we also have more advanced AI, and that's really machine learning. And that's where we have predictive analytics that are sitting on vast or built on vast amounts of data sets, and they're looking at past history to try and predict the future. So an example of that would be that patient shows up to the ED. What's the risk that they readmit to the ED in the next 30 days? And what they're doing is with the machine learning algorithm to predict that risk, looking at all these past events from other like patients, their trajectory, and they're looking at what this patient has in front of us today and trying to predict, well, it looks like the trajectory looks like they might be a high risk for potential ED readmission. And then you have generative AI. And generative AI is really where people are most excited about these days. Things like ChatGPT. You saw if last weekend on 60 Minutes, there was a whole section on Claude and all these new generative AI tools that are based on large language models, which are trained on trillions of different data points. And what they're trying to do is leverage that AI to be able to generate new novel content or take a prompt that goes into it and be able to then generate what they think probabilistically would be the most likely output that that user wants. And so generative AI offers a whole new host of capabilities that are very exciting, but also come with a lot of risks. So the value proposition for AI at a health system is vast. It can do things like enhance our quality care and outcomes. We're able to better identify patients that have care gaps and then be able to proactively outreach to close those care gaps. It can certainly decrease clinician care team burnout. So being able to have a tool like ambient documentation to help take notes, we know really drives down that administrative burden and can really help with the day-to-day just administrative tasks that we have to adhere to in healthcare, whether you're a nurse, a provider, or a care team member. It is the ultimate automation tool. So, from an operational efficiency and cost reduction standpoint, it can help make a lot of these manual processes that we have today more streamlined in various different ways. It is a tool that we believe very strongly at Brown University Health can empower our workforce, which is a theme that you'll hear me come back to time and time again. It's not about replacement, it's about empowerment and making sure that we give the care teams that we have and our employees at Brown Health and at large access to these tools so that they can use them in their own workflows and hopefully be a huge catalyst for innovation, creativity, and solving some of these acute challenges that we're facing as a health system. If we have an AI strategy as a health system, that means that we can govern it, have the security behind it, and make sure that we're compliant. So that's so critical as we embark on an AI journey at Brown Health. We want to make sure that we have the right oversight, the right guardrails in place to make sure that we're doing it safely and responsibly. And ultimately, if we lean into AI and we can really become an industry leader, well, we can be hopefully an example for industry at large, for innovation, enabling our researchers across the board to be able to validate and vet AI in new ways and figure out ways that we can enhance and really have better throughput to discovery. So looking at how we could, find the next medication that could solve a disease or be able to find the trends or correlations out there that could really move the needle in a new treatment. And so that's just the promise of AI for the organization is vast. But there's a duality to it. And so this is an example that I often use. On the left-hand side, it is I just any given point in time you can do this. Google what is the benefit of AI in healthcare, and you will get a list of 150 pages of different examples of how AI is doing good in healthcare. It is helping with better diagnostics, it's helping improve safety, it's helping with better screenings and earlier detection. And then on the flip side, if you Google what are the risks of AI in healthcare, you will get another 150 pages of examples of where it might be introducing new challenges or new risks to an organization, where all of a sudden people are having work slop that's spreading all across the organization, or they're not vetting or validating the output, and all of a sudden we could be introducing harm inadvertently to the organization. So there's just this real duality where there's a lot of benefit and good it can do, but there's certainly a lot of risk that comes along with it. And what we need to do is set a foundation that can responsibly adopt AI. And we'll get into what that looks like and how we're doing that at Brown Health. So I will say that we're standing on the shoulders of giants. There is a lot of good guidance out there and best practices that has been developed over the past few years around what does responsible use of AI in healthcare entail. And a lot of what you're seeing, what we're putting in place at Brown Health is very much in line with the guidance that you see here. And this was coming recently from the Joint Commission and the Coalition of Health AI, or CHAI, as the official guidance for responsible use of AI in healthcare. And some of the key components are you have an AI policy, there's governance structure in place, we're being really thoughtful about patient privacy and transparency and explainability. We're being understand the data security and the data use protections behind any AI that's being leveraged. We're able to monitor it ongoing, not just as we're testing and validating it up front, but that we understand how it's performing over time. We need to give people an outlet to be able to actually report any type of events that they see where the AI might be introducing unsafe conditions. We also need to be cognizant of things like risk and bias. And then lastly, we need to make sure that we have a culture and a space in our organization to have continuous learning, education, and training. So thank you all for joining tonight. This is a really important part is being able to continually stay up-to-date trends and train and educate yourselves on AI so that you can be advocates for it in your own organization. Our AI strategic foundation is built on similar pillars. So our North Star is governance. First and foremost, we want to make sure that we have the right guardrails and guidelines for AI before we introduce any new tool into the system. And we want to make sure that we have a responsible AI framework that the entire organization can get behind. Then we want to make sure we're educating our workforce on that new policy, on the governance that we have in place, and how to actually use the tools in their day to day and get the most out of them. We want to make sure that we have the right technology and the right data behind it. Data is the lifeblood of AI. If we don't have good data, you're not going to have good AI. So we have to make sure that our technology strategy and our data strategy are aligned. And that ideally is coming to life through high impact use cases with the organization. So partnering with leaders across Brown Health. It could be clinical departments, nursing, it could be care team, community engagement, it could be back office staff that we're trying to engage on their high impact use cases to bring AI to life in a way that drives value for the organization. And it also takes significant investment to do so. So we're looking at what are the strategic partners we want to bring in to help bring AI to life? What are the right technology partners? What are the right strategic priorities that we have at Brown Health that we need to align with investment and making sure that we're able to move this work forward. And then last but not least is the research component. This space is changing every day. We need to continually research it, make sure that we're staying up to date and enable our researchers to be able to understand the challenges, the benefits, the risks, and vet and validate any AI that we bring into the system. So this is how AI is coming to life at Brown Health, and we'll get into each of these components in the subsequent slides. So starting with governance, we have a multi-layered governance approach, and this was one of the first tasks for us as we established the Center of Excellence at Brown Health, was bringing together leaders across the organization to understand what is AI, what's the potential benefit, and how do we align around it. And so we have an executive oversight council, which is really our board. And that board is made up of the C-suite, and they're really looking at what are the strategic priorities we have at Brown Health, where can AI align, and how do we direct investment to make sure that we're able to support those initiatives that we want to commit to. Then we have the AI Governance Council, and the AI Governance Council is something that I think is really awesome and a testament to Brown Health. It brings leaders across the organization. So we have legal, compliance, privacy, nursing, clinical providers, community engagement, bioethicists. We have HR, obviously a bunch of technology representatives from IS and being able to make sure that we have good data representation as well. But you really see a multidisciplinary approach that has brought all these different perspectives across the organization into our governance council to define what does responsible AI mean for Brown Health and what are the guardrails and guidelines that we want to put forth to make sure that we're able to safely adopt AI. Then underneath that, we have subcommittees, and the subcommittees are really focused on enablement of the portfolios. So as we start to have the rules of the road and we understand what tools we're going to commit to, well, these subcommittees are bringing them to life, understanding where are the high impact use cases in each of these areas, making sure that we have really good knowledge sharing and can start to learn from each other as folks start to embark on implementing AI and can bring that forward and bring it back so that there's an accountability cycle that we're able to adhere to. And there's a business subcommittee as well, more focused on the business backend, and then a research subcommittee that is trying to enable our researchers. So all of this comes together in a really, I think, strong governance infrastructure that actually isn't as bureaucratic as it seems. It actually enables us because now that we have these groups coming together, we're able to accelerate everything we want to do going forward. So I keep saying responsible AI, and I want to just define what that means, particularly at Brown Health. So first and foremost, is the AI secure? And we want to make sure that we're using AI that has first been vetted by IS and has gone through security reviews. What it means to be secure from a technology standpoint is that we know where the data is going, how it's being used, is everything being stored in a HIPAA compliant environment? Do we have the right networking and connections to, with certainty, know that nothing is leaking out of our system? So it's really around the right agreements are in place from a contract standpoint. We have BAAs with any of the vendors that we're actually using AI with. And then we also have all the standards in place to make sure that from a technology standpoint, everything is secure. Then is the safety bucket, and it is AI safe. And so the first thing about safety is we want to understand the potential risks that can be introduced into the system by adopting this AI. And so for any new use case, we do a full risk mapping and then also identify mitigation and monitoring plans for any of those risks that we identify. A really important part of any AI initiative is understanding where is the human accountability in that AI process. And that really comes down to clearly defined human in the loop standards. So, an example would be we know that our providers can have access to ambient documentation, but they are still responsible for reviewing any note that gets generated. That's human in the loop, making sure that there's always human eyes on any AI output and that our professional and clinical judgments stay in the loop. Then there's ongoing monitoring. So it's not just about vetting and validating that the AI works in a test environment, but there's really all these new types of risks that can get introduced. It can drift over time. There's a term that you'll often hear where the AI can hallucinate, which means that it's just making things up on the fly, and it can be really convincing as it does it. So it can be tricky to catch. We need to make sure that we have the right monitoring capabilities to be able to proactively identify when that's happening and then put the right controls in place to either stop that from happening or make sure that we're able to update any of our processes to make sure that we can prevent it from happening in the future. And there's also all these new types of risks that get introduced from AI. You'll hear terms like jailbreaking or prompt injection, and there's all new nefarious ways that, particularly with generative AI, bad actors can start to get in and do things within our system that we really want to prevent. So we're constantly looking at secure platforms that have resilience capabilities against those ongoing threats. And that's why it's so important up top to have secure AI that's been vetted by info security and that we know from a technological standpoint is locked down and we don't have any vulnerabilities. Then we get into the responsible bucket. And responsible is really around making sure that we're using AI that in a way that drives value for the organization. Driving down clinician or nursing burnout is a huge one. Making sure that we're able to have a better patient experience. On those back end use cases, seeing if there's an actual ROI that is driving value for the organization. We want to make sure we're using AI in ways that drive value overall and aren't just using it for the sake of using it. Then we want to make sure that our target end users, the folks that are actually supposed to be using the AI, are trained to use it. So making sure that there's good training protocols in place. We have Jody Velarde and team on tonight. They're amazing in making sure that they're ready to go and that our end users are prepared to actually use the AI solutions. And then lastly, you can spend a ton of money on AI. It is always in the news, another billion over here, another billion over there. We want to make sure we're being really conscious about any of the cost monitoring in place. We do not want to be wasteful with this resource. And that's really important to have good cost monitoring in place so that we don't balloon budgets and we're staying and using it in ways that are fiscally responsible. And the last bucket is ethical. And this is really making sure that AI is transparent to the end user. A good example of this is if a provider is looking up, to be able to check a reference that it cites its sources and that we let the provider know that AI is actually doing that search on the back end. So making sure if a patient's interacting with a chatbot, the chatbot discloses that it's AI, not actually a human on the other line that's doing the typing, and making sure that it's just very apparent to anyone that's using AI that AI is actually being used. Then we want to make sure that we're being really thoughtful about the impacts to our people and the environment. And that gets back to the responsible bucket, making sure that we're not just wasting this resource and doing it in flippant ways. We want to make sure that we're being thoughtful. This takes a lot of energy to use AI. The only way that we justify that is if we're using it in ways that further patient care or can, further the overall mission of the system. And then lastly, we want to be really thoughtful about equitable scaling. Oh, sorry, I skipped. Importantly, monitoring for bias. So monitoring for bias is really around understanding how is that AI trained. A good example would be at MGB, we had a dermatology AI assistant that was able to read pictures of skin rashes and then give the doctor a recommendation of what it most likely was the cause or the underlying condition. It worked really well on light skin. It didn't work well on dark skin. That's because the whole AI that was being used was trained on light skin images. That's an example of inadvertently introducing bias into a system. You need to understand how the system was trained, the data sets behind it, and making sure that we're not inadvertently making another population that we have, not have the same equitable experience just because the AI wasn't trained to be able to identify their needs. So really being thoughtful up front to make sure that we're not increasing any of these disparities. And then lastly, equitable scaling. So making sure that we're not just giving AI to a select few, that we're democratizing access and that folks are ready to take advantage of the tool. We don't want to create just a few superstars and leave everyone else behind. We want to be thoughtful as we roll out these tools and really be thoughtful around the impacts to our people and the job functions along the way. And all of this is governed by that governance structure up top that was set forth in policy by the Governance Council. To bring the AI to life in partnership with the subcommittees and the different teams and champions across the organization, we have established the AI Center of Excellence. And our mission is threefold. First and foremost, we want to educate the enterprise. We want to make sure that our workforce has a trusted source to be able to upskill and understand both the benefits of AI and the risks of AI. Then we want to enable our teams across the organization with secure AI that they can use in their day-to-day. And lastly, through governance, through strategy, policy, expertise, and partnership, we want to empower those teams to really bring as much value from that AI as we can. And that's where we partner hand in hand with any team that we're working with. So the AI Center of Excellence, educate, enable, empower, that's our mantra. We also only have 3 employees, so that might have been manifesting the team size as well. Hopefully we'll grow over time, but it's certainly the multiple layered meetings there for you. And so when you start to engage with the AI Center of Excellence, you get into our standard operating procedure. And this is where it's really important because this helps ensure that the AI is secure and safe. So we have a 2-tiered risk assessment protocol, or TRAP. And this is where we're trapping bad ideas and risk up front. And so the first step of the process is a consult with the AI Center of Excellence. If someone has a new idea or use case for AI, they can submit that to us, and we'll go through and we'll do a review. Next, if it seems like it has legs, we'll do a formal assessment, and we'll get into that assessment shortly, but we'll get in and make sure that we're starting to think through what are those potential risks downstream and how do we make sure that we can monitor for those and make sure that we also understand what are the key outcomes we're driving towards for this use case. Then we go in a crawl, walk, run approach. So we might prototype at this stage and get just a understanding of does AI make sense or not. Then if it does, we'll move to a small scale pilot, maybe a few users, a handful, friends and family. That then goes into a bigger pilot if it seems like it's successful, where we try and get it into workflow and really understand its impact. And only after it's at multiple milestones of review and governance, and we understand, the pitfalls, but also the benefits and where and that it is truly safe and okay to move forward with, then we look to scale. And being able to scale means that we have the funding for it, we have the champions behind it, and we have the operational infrastructure to actually support it ongoing. So when we start with that initial consult and we're going through and we're really identifying the champions behind it, making sure that we understand the financial value, what are we trying to drive from a clinical outcome standpoint, what are the overall alignment with strategic priorities and making sure that it is a good idea. But then once we wanted to actually do the formal risk assessment, we've worked with some clinical researchers, actually an incredible one at Brown Health named Grayson Baird. He's our vice chair of radiology, but he's done novel research for years on safe implementation of AI. And he helped develop this assessment for us where we're really trying to tease out what are the downstream effects on decision making and any of the unintended impacts that AI might have if we introduce it into any type of workflow. And so you'll see here on top, what we're really trying to tease out are what's the value? If AI gets something right, what is it going to mean from a business standpoint? What's it going to mean from a medical clinical outcome standpoint? What's it going to mean for just the overall value of that use case? But then on the bottom, what we're trying to tease out is, okay, AI can get something wrong, or it could maybe cause someone to do something wrong. And then that could be in the form of a false positive where it says someone has something and they really don't, or a false negative where it might miss something entirely. And these different types of errors that happen with AI. And we really want to make people take a pause up front and start to think, all right, if this happened or this went awry, what are those risks that we might be inadvertently introducing into the system? And what would those potential negative outcomes be? What this does is it gives us a scale to basically start to weigh against each other the potential benefit of AI versus the risks. And if that equation is not tying out, then we will pause that initiative and we will not move forward. Or if it does and it makes sense, then at least now we also have the criteria of what we want to monitor ongoing. So it's a really helpful exercise that makes people critically think what they're trying to implement with AI, but then informs downstream how we can make sure that we stay safe as we progress. As we go through that exercise, it ultimately gives that AI use case or AI solution, it puts it into a risk tier. So some low risk things we'll feel comfortable about moving forward with. We'll still want to make sure there's validating and monitoring in place. But anything that's medium or high risk, we're going to want to make sure that it goes through much more extensive validation, that we're testing it both during and after its implementation, that we have the right monitoring plan. So this risk tiering really helps determine what is the right path for that AI to progress safely within the system. And then we get into our validation and lifecycle monitoring. So once we have it, we'll get into this validation phase where we'll have a sandbox environment, which I'll show you, where we'll start testing. And we might test it on historical data to see how well it's performing on outcomes that we already know. And then we would get into a space where we would get into the pilot stage, where we might give it to the access to a few subject matter experts and eventually give it access to, maybe a couple dozen folks to see how well it works in workflow. All along, we're monitoring and making sure that does this meet the criteria to move forward for scale or not. And this is a virtuous cycle that continues even from pilot into actual production operations, where we will have different versions of this cycle depending on what stage the AI is in. But it's really important to know that upfront, there's a lot of validation. We start small, and then the monitoring piece is so important for anything that we're doing. So now we get into the enablement phase, and this is where we can start to look at the different layers of value that AI can provide. So the first thing it can do is for personal productivity. And this is really the idea that you can go out to a large language model today and get a lot of value just by interacting on it for a task that you just need to do at a point in time. Then you have assistants, and assistants are taking these large language models that were trained on the history of mankind and that's grounding them in a few set tasks that it is becoming an expert in. So this could be an assistant in Epic that can consistently go and do chart summarization, or an assistant in Epic that might go and be looking for the right codes to add for our coding staff. That's an example of a workflow assistant. It's typically embedded in the platform, but it's using a large language model that's focused to do one or set of tasks consistently. And then you get into more complex automation. And this is where you get into agentic AI. And agentic AI is where you start to take these large language models and you fine tune them, or you ground them and train them on our policies, our procedures, our workflows. And then you can have multiple agents all in the same sequence that can automate fairly complex tasks. So this is a sliding scale, but there's value that can be derived every step of the way. So our enablement strategy at Brown Health started with how do we make sure that folks are able to use secure tools on their day-to-day work? And that's where we wanted to democratize access to large language models. We were, as an organization, committing to Microsoft, and so we use Copilot. And Copilot's great. You can go out to Copilot chat. It's available for the entire organization today. You can go and use it to summarize meeting notes. You can use it to generate a project plan. It can do some basic data analysis for you. It's a really nice tool in the toolkit. Then there's pay for play, and that's where we start to look at some of these more subscription-based tools that we have, and they're really decreasing burden, whether that be ambient documentation for our providers or the paid version of Copilot that can do a whole host of other, tips and tricks for the user. So it might be able to help the data analysis do more efficient data analyses, or it might help, researcher or administrative staff or executive go out and get research a topic and be able to bring back a whole report on trends and what's happening out in the market. Then we get into agent and assistant development, and this is where we've really committed to we want to be able to build agents for Brown Health with our end users. So we've met with staff across the organization, and this is where we can take these large language models and say, all right, in your department, you have these policies, these procedures, these algorithms. How about we partner and we can actually train an agent to help you in your day-to-day work? And we're really investing in that infrastructure, and I'll show you that in a minute. And then lastly, we have research and innovation, where we're focusing on there's a new model that comes out every week. How do we make sure that we're staying up with the times? How do we make sure that our researchers are the best and the brightest, are enabled with the best and the brightest AI? And that's where we're really focusing in on our cloud infrastructure and making sure that we can get access to models early and make sure that we can support our researchers and clinical innovators. So this is our general enablement strategy. Just to show you, I'm going to jump over for a quick demo if you don't mind. So I want to just demystify this idea of an agent. So as we went through, you can see here, we're in our sandbox environment. This is called Copilot Studio. And a couple of things to call out. You can pick a model. So that's that large language model I keep talking about, where it might be GPT-5 or another large language model that we can choose like Claude. But this is giving the AI the base capabilities. Then we're able to give it a consistent set of instructions. So this is a discharge assistant that we're prototyping. So you're a hospital discharge assistant that is an expert in our policies and procedures, and you can provide the care team guidance on discharge services. And then what we've done is we've taken all of our different policies and procedures for discharge, and we've trained this agent on it. So Brown Health has done a phenomenal job of documentation over the years. They have all their algorithms and PDFs and guidebooks and playbooks, and that actually works really well for AI because that's what it's going out to read. So we've trained an agent. This is just a prototype. This is nothing that's in production by any stretch of the imagination, but just to show you the art of the possible. Now we have this discharge assistant over here, and we can give a case. And so I have a 75-year-old female, left leg amputee who can ambulate 200 feet unassisted. She has family support at home. What is her recommended discharge? This was actually a really tough case for our case management team and had to go through all different councils to get the right answer. But now that we've trained it on all the policies and procedures, you're going to see the AI go out. It's going to go read all those policies on the fly. We're in a test environment, so it's a little slow, and it should give the recommended discharge disposition of home with support services. Unless it makes a liar out of me, we'll see it. But just to call out what it's doing, you can see it went through, it found the right policies. It was able to digest those and then apply the logic into what the ultimate recommended discharge disposition is. So home with outpatient services. And then it even goes further to start identifying services that we might want to arrange, and then also some additional guidance based on what's in those policies and procedures. Now, what's interesting is this is a really simple agent up front, but you could see how it could start to potentially even help take action beyond this. So could it help draft the discharge instructions? Could it help provide the referral information that needs to be sent over to the outpatient therapy services? So there's just, you can see there's so much potential for this, not to just provide information to the care team, but help them take next action as well. So just to demystify the agent space a little bit, it's really being able to take these models and then applying knowledge to it and then seeing what actions and tools it can help facilitate. This is just to bring that assessment to life. So this is on that same inpatient discharge assistant. You can see if everything goes well, great. We have now a discharge assistant that's helping direct patients to the right level of care. It's making sure that we're driving down the risk of readmissions. It's improving their overall medical outcomes. We're building trust with the community, with the payers, because we're being good stewards of our resources, making sure that we're not introducing inadvertent waste to the system. It's a good outcome from a value statement if it gets everything right. But what happens if that same AI starts to get things wrong? Well, then it might either make someone go to the wrong site of care and get too much. So it might discharge them to the SNF when they really would have been eligible to go home. Or even worse, if they needed to go to the SNF and they actually sent them home, well, that introduces all sorts of liability. And so you can see where we start to use this tool to tease out that risk and making sure that we're looking at all the different types of ways that errors can happen within any type of assistant And then this would help also inform what are we trying to look for from a negative outcome standpoint? How are we going to measure if the AI is working well? And what are the types of errors that we need to be monitoring for to make sure that it's not going off the rails? So just to show you how that assessment comes to life. Now, there's lots of promise here in the clinical realm. And so you have, I'll start on the right, other systems. So some of those custom assistants and agents, there's all sorts of AI already in radiology, pathology. But where we're starting to really invest and move the needle is investing in AI within the EHR so that we can make Epic more easy to use for our nurses, our care teams, our providers. Also introducing ambient documentation. And ambient documentation right now is provider based, but it's also become a tool that's becoming more and more dynamic that can do things beyond just generating the note. We've seen for the providers that this is from my time at Mass General Brigham, but for the providers that were using ambient, it had almost a 40% reduction in overall burnout. It also enabled folks to almost completely eliminate pajama time in some of their specialties. So the time that they spent doing notes after hours. And not only that, the best part about it is it actually gave them the time and the space in visit to focus more on the patient rather than the flow sheets that they have to fill out or the notes that they have to put in to make sure that the right charge drops. They're able to just give their undivided attention to that patient, and it's increasing patient satisfaction as well. So there's some real benefits of ambient, and we're seeing it have a real positive impact. And this is the type of value we want to see for any AI initiative to justify keeping on that investment and keep scaling it across the organization. And it's evolving too. So it does the clinical note now. It has services that will start to help make sure that we have the right documentation integrity, we have the right codes that get dropped with it, but it's expanding out beyond providers. So it's coming available to nursing now too. And so excited to see how this will start impacting our nurses. And we really want to target a pilot for this in 2026, but this will actually not just generate a note, but it will actually start, filling out those flow sheets appropriately, helping the nurses navigate all those long forms that you all have to fill out time and time again, all those smart forms and smart text that needs to be incorporated into the encounter or the episode. It will be able to start discreetly filing information too and really helping nurses focus on the patient and not have to be worried about all those clicks. And then also it will start to introduce things like clinician decision support, and then downstream being able to use this type of tool to identify patients for programs and services they might be eligible for. That could be a clinical trial. It could also be, if they have a social determinant of health, a community program that might help them get the need or support that they need. So there's just so much good that can be done just on this ambient platform. And then we have our Epic Assistant as well. And this is where we're starting to, infuse generative AI within Epic, and we're going to start to look to pilot these in the coming months. But just some examples of Epic generative AI. This is an example of inpatient insights, and both our nurses, care teams, and providers can potentially use this tool where they can go in and summarize that full hospital discourse. Give me the key information that's happened since the last time I saw the patient, or the last time I was rounding. Go in and give me the full summary of that patient's discourse, and then help me, actually write that discharge summary. This is also available in the outpatient setting. There are other tools that are helping navigate the in-basket, making sure that messages get to the right provider or the right nurse or the right care team member at the right time. Looking at how we can help just speed up some of these administrative processes within the EHR itself. There's a lot of great investment that's happening here, and we're seeing more and more features come online. And then we get to patients, and there's so much promise for patients as well. We know that, healthcare is often fragmented for our patients today. It is hard to navigate, but now you take that same type of agentic tool that is helping our providers navigate complex policies and procedures, and we can use that same tool to enable our patients to have a better journey. So from the time that they're looking for us online, we're able to have them, come to our Brown Health website and potentially use AI to help find the services that are more relevant for them, or just understand what is out there and what could help serve them. Then we're able to take that same type of AI and put it on our contact centers, or even just on that same, chatbot instance, offer it a scheduling opportunity so that they can find a provider that's right for them, but also book an appointment at the right time for them and, their convenience. That same AI can then help prepare the patient for the appointment. looking at opportunities to make sure that they have the right education before they arrive, the right instructions or setting expectations, gathering the right registration information, making sure that they're reminded that they should actually come to that appointment. All of this right now is often, just blast text that gets sent out or phone calls, but it can be personalized with AI and making sure that we're driving towards a better overall patient experience and that they're ready when they arrive. In visit, it can help them actually, again, directions or navigating the buildings or hospitals that they're arriving to. It can help, obviously, when the visit documentations, being used by the provider in terms of using ambient, they have a better experience because now they're feeling more connected to their care team and feel like they're being heard. And then those same types of AI tools can be used to generate an after visit summary in their language at their reading level without losing the medical and clinical integrity of what's being said. Post visit, we can have AI that can help make sure that they get the right education or follow up, can navigate some of those referrals that need to be made, can make sure that they're able to get the support in the community that they need. And then lastly, on the far end, making sure that ultimately they can get the financial assistance if they need financial assistance, helping navigate their payer dynamics that they might be faced with, and it can really help from start to finish just the entire patient journey. So we're very excited about the potential here. You can see, though, we're not starting with patients because we want to make sure that we have a really solid foundation before we make anything patient-facing. The last piece in here is a glimpse into the future. And this is where I just wanted to call out. You start to see generative AI, and it's all conversation, right? Like AI is such a novel tool. It's so approachable because you can just talk to it to get what you need. But that conversation is going to provide a lot of insight. And so if you start to think about that's what it's trained on. It's trained on text mostly. It's trained on knowledge. It's trained on documents, but it can also be trained on interactions. And so if you think about all the different types of insight that we can get out of the notes that are typically non-discrete fields, some of the conversational context that might happen within ambient, all this different types of data can come in, and then we can use AI to do a review of quality, safety, and value. And then we can also use that same type of data set to start training new AI so that it can help do all sorts of novel things in support of our mission. And that's where having an understanding and strategy around the data layer is so important. And the way that we're starting to think about that now is that you have an operational clinical data layer. That's identified information that's only going to be, kept for a point in time or be in the EHR. And that's where we're looking at quality, safety, and value reviews and making sure that everything's done in regulatory compliance, HIPAA secure environments, and that we have full access control over it. But then we can use AI and actually de-identify that data. And by de-identifying it, we can actually enable our researchers with data sets that they'll be able to further the mission of novel discovery and being able to also study AI or develop AI. And then lastly, we can take that same set of de-identified data and actually use it to create synthetic data. And synthetic data lets us start to use AI with outside partners. So it's completely safe because there's no tracing back to any patient that has ever been in our system, but it allows us to have at least a good enough data set to start prototyping outside of our four walls, partnering with academia to be able to come in and students to train the next generation of potential, AI enthusiasts in our health system or beyond, and also looking at other opportunities within the university and the research space to be able to build novel new solutions for healthcare. So there's a huge promise here around not just what AI can do, but how we can use AI to really move our data ecosystem forward and really hopefully accelerate discovery, get better outcomes, get better treatments out there, and really move the needle for both our care teams, our providers, but ultimately our patients. And so I'm a little ahead of schedule. I apologize. But the key takeaways for tonight, and what I want to make sure that we had time to have question and answers after this. But the key takeaways for you all: AI is transforming healthcare, and it's coming. It's already here in a lot of regards. Um, but what really matters is how we responsibly adopt it, making sure that we have the right controls in place from a safety privacy standpoint, making sure that we're not introducing inadvertent harm into our system. We really need to stay up to date on any of the new developments with AI. So ongoing education is going to be critical. This is a fast-moving space and it's evolving every day. But your voice is going to be vital, and your perspective and your guidance is going to be vital. How you start to adopt the tools, or how you can advocate for the responsible adoption of those tools, and making sure that you're comfortable with AI so that you can make sure that your colleagues are comfortable, ultimately, or your patients are comfortable with it in ways that can really move the needle and hopefully transform healthcare at large. So, a call to action for you all. You're already doing it. Thank you for showing up tonight. You're engaged, you're here, you're learning. Hopefully you had some key takeaways from tonight. But then I would encourage you to look at your organizations that you work for. Look for opportunities to collaborate. We need more nursing champions in this space, and champions that can help advance how to use AI for nursing, but also making sure that we're using it in ways that can be safe and responsible and ethically used across the system. And having your guidance there is going to be critical. And just anyone can lead in AI. I know AI can be really intimidating. It is one of the most approachable technologies that's ever been released. You're not behind. It's still very new. So by taking the time to learn it, you can be part of that leadership of change that can help guide AI responsibly into your health system. And also, it is such an outlet for innovation and creativity. So just being able to understand it a bit, you're going to be able to unlock novel use cases in your areas. You're going to figure out new ways to use it that no one else has. There's just a ton of opportunity to really, I think, tap into that creative spirit. And I think the chance for nursing to shape AI in nursing, we're just getting started. So this is a great time to get involved. And I wanted to leave time for questions, but just a sincere thank you for the opportunity to connect tonight with you all. Hopefully there are some good nuggets of insight here, and I'm happy to open it up and dive in deeper in any area that you'd like.
Matt, this was a fantastic presentation. Thank you so much for being willing to come and speak with us. I probably have 100 questions that I could ask you.
We have plenty of
One of the
time.
one of the things that there's much concern over is the cybersecurity side
Yep.
of these tools. And we know that it's moving at the pace of light, right? So it's moving faster than um, generally speaking, we can keep up with. So
Mhm.
how do you ensure for Brown Health, how do you ensure that you are meeting the requirements to be able to protect patients and protect staff as you're bringing on these tools? Because we know, even though the government has given some, feedback, there are really no set rules for
Right.
the development of these tools. So how are you as an organization ensuring um, people's safety?
Yeah, no, thank you, Paul. So it's such an important call out. There really isn't a ton at the federal level in terms of guidance or mandates, and obviously there's a lot of back and forth between the Fed and the state level around what should or shouldn't be controlled and regulations that should be put in. So our approach is really we're committing to responsible AI. First and foremost, from a secure standpoint, everything has to be reviewed by infosecurity. What they're looking for is, do we have the right connections in place? And that means, are things privately networked? Do we have secure connections with the AI? Do we understand how that vendor or the AI itself is using our data? And making sure that we have really good traceability and audit in any tool that we're bringing online. So that's the first layer of defense, making sure that we're able to integrate it into our platforms and technology, and then making sure that we're only using those tools that have been sanctioned and reviewed. So that's been a huge part of the work for the first 6 months of the Center of Excellence, is starting to make sure that we have a viable alternative that is secure. So Copilot has gone through a full vetting. We know that it's secure. We know that it's safe. Now it's going through and making sure that people aren't out there using public versions of ChatGPT or out there using apps that have AI on them. And that's really where the risk starts to get introduced. If you're not using sanctioned tools by your organization, there's all sorts of nefarious ways that AI can go awry. So having a really good security posture up front as part of any type of AI system that we're bringing in is our first pillar of responsible AI. That's why we started with secure. And again, that gets into the networking, the configuration of it, how data is used. And we know that the tools that we have approved are actually secure. But then what we're also doing is we've started an AI registry. And so for the organization, any tool that's actually vetted for the organization lands in a registry that we've made available to the entire organization. It goes through, it gives examples of what data is approved for that tool. So some tools you can use PHI, some tools you can't. Some tools should be used in the clinical setting, some should be used in the back office. We're teasing out all this information in the registry to make sure that folks have visibility and there's transparency into when and where to use that AI. And that's going and making sure too that they have a source of truth to say, hey, if I don't see it on this list, I really shouldn't use it. And then we're looking to block anything that's not on that list over the coming months. So it's really setting expectations of what is that security review that needs to happen up front, putting some guardrails and guidelines around making sure that folks understand what is available to them, and then starting to lock down the rest of the ecosystem so we can't have people come in through the back or side doors.
Such a great response, and so glad to hear that your organization is really doing that work. I do have one follow-up question, and then I'll open it up for the audience. So you speak about using agentic AI, and I think that may be somewhat of a new term for
Yes.
many of our members. I just recently came back from the EMEA 2025 symposium on Wednesday. And so there's a lot of discussion about agentic AI. And in some regards, agentic AI, and I may not be representing this correctly, so please correct me if I'm wrong. But agentic AI, each agent in the chain has the ability to do a specific task.
Mhm.
But from the sounds of what I heard this week, is that they actually can create a chat loop. So if one component of the agent chain doesn't understand what's going on, it can send it back to a different agent. So can you explain that a little bit more? Because I believe this term is going to become much more broadly used, and I just want to make sure our members really understand what that technology is.
Yeah, no, it's a great question too. And it is like the new flavor of the month in the AI space. So now everything's agentic, and you'll see these terms pop out of nowhere. This is certainly one of the newest ones to come into the industry. So agents, so we walked through that discharge assistant. That's a good example of an agent. You have a model that's behind it, which is a large language model. You've now trained that model on specific knowledge sets, and then you can give it the capability to take action. But oftentimes that action is going to be limited. So you don't want to be able, or we don't have the capability right now to just have an agent that does everything for everybody. You want to make sure that it's trained on specific sets of tasks. And then when you start to get into agentic AI, it could be multiple agents along a string of workflows that would help be able to actually complete the end-to-end task. And so an example would be like the discharge assistant might be able to, give an example of the discharge disposition, but then you might have a referral agent that it pings to say, okay, now the referral agent is going to be trained on scheduling and being able to place referrals and be able to route referrals or making sure it's collecting the information. So it might take that information and pass it off to the referral agent that's going to go try and execute the next task that is in that workflow. So all these agents are basically trained on specific tasks. Now it can get very complex, and you can have agents that can do a number of different tasks all on their own. But then you might have an agent that's checking their work. And so it could be, an agent that's looking at that discharge disposition, but then going and looking at hundreds of other examples or thousands of other examples and then reasoning over it to say, is this actually right? Should we have one more check before we recommend this? And so there's lots of different ways to introduce AI, but they're typically these large language models that are focused on a specific set of tasks. And then agentic AI is the orchestration of multiples of those agents in the same workflow.
Great, thank you. We have one question in the chat, and the question is the large language model specific to Brown Health, part of Epic, or other?
Yeah, so we're using what's called frontier models, and the frontier models are like the big ticket players out there. So you'll have ChatGPT is one of them, and the OpenAI models. Claude is another set of models. You have Grok if you're going to use, the XAI. You have Llama, which is the Facebook AI. Gemini is the Google AI. So there's all these different large language models that have, different hyperscalers that are backing them. What we've done is we're using Copilot, which is a secure connection to ChatGPT so that none of that data gets used by ChatGPT for any type of training. Nothing gets retained by ChatGPT in any sense, so that we don't have to worry about it leaking out from any type of sensitive data perspective. But it's then in a wrapper that Microsoft has provided to make sure that we have all the secure tools around that model to be able to use it with our data within our workflows. So a good example of Copilot would be it can be in Outlook, right? Your email, and it can go through and it can summarize all your emails. That's basically ChatGPT on the back end, reading your emails with a controlled instance of Copilot, but nothing is leaving our tenant at all. So we don't have to worry about data leaking out. We don't have to worry about exposing data that's inappropriate. Everything's secure, everything's locked down, encrypted, and to our standards. So you're often going to see companies that are using these large language models, but putting some type of wrapper around it to make it secure. And then it's all about the nuance of how they're actually making it secure to determine if it's something you should use in your organization or not. Same with Epic. Epic is using, it's not Epic's large language model. They have some of their own now with Cosmos and Comet AI, but for the most part, they're using Claude or ChatGPT, and they're just using it in their ecosystem in controlled ways.
Do they manage to account for the population of patients that you have in your environment so that you don't have bias or you don't have hallucinations?
So the two different types of flavors there. The predictive analytics that we have need to be oriented to the populations in our setting. So an example of that would be, I'm sure you heard in the news years ago when Epic first released their sepsis model. It wasn't trained on a population that was really representative of most health systems. It was just trained at one or two health systems. And then when it was introduced into other health systems, you saw it deteriorated rapidly and didn't have great outcomes. That's an example of needing to make sure that a predictive analytic and machine learning algorithm has time to learn your own data. Generative AI typically isn't going to be trained on your own data from a bias standpoint, but it does have the risk of hallucination. So that's where you can start to put controls around it from a prompt standpoint and also just how you orchestrate the use of the LLM to make sure that it's not hallucinating. So, and then understanding that same large language model, there are all sorts of benchmarks now to understand kind of its propensity for bias, it's any of the risks that it might have for drifting or hallucinating. And so you're able to see the profile and then make sure that you're using the right model for the right task, for the task at hand.
Great, thank you. I'm going to open it up to the rest of our members who are here for any questions that you might have.
Hi, it's Leslie Hutchins. I'm from Yale New Haven Health, Chief Nursing Information Officer there. So great to meet you and fantastic presentation. Greatly appreciated. I specifically like the slide where you really showcased the outcomes, the KBIs. And I think that's so important, right? We put a structure in place, we put a process in place, but then how do we measure that? And really appreciated that you took that component and put that in for every component that you displayed there. So thank you. That I think that's what we should all be doing, as we look at our initiatives. What do we hope to accomplish? And we may accomplish other things besides what we thought we would accomplish, but again, that was great. And then a commentary. I've had the opportunity over the past few weeks to round in multiple hospital campuses. And our nurses have an appetite for this. That's what I'm finding. I don't know what others are finding, but our nurses are ready. They have an appetite. I am not hearing a hesitation. They're ready for it. And I think because a lot of them are using it in their everyday life, right? We go on vacation. Let me throw it into ChatGPT. I'm going wherever I'm going, right? Whether it's in Florida, Italy, tell me what I can do, for a 3-day trip or a 5-day trip. And they have an appetite. And so I think we need to educate them because they do need to know what are those hallucinations, what they need to be on the lookout for, so that they're aware of that as they review the output from it. But once again, thank you very much. This was very informative.
Thank you so much, Leslie. And I just want to echo, as we've gone and made our rounds, nurses are some of the most excited folks that we talk to at
Good.
our system for AI. They have so many great ideas on how to potentially use it, which is exciting, from education opportunities to better scheduling to everything in between. So it's so exciting to see their enthusiasm. And you can see it can be really rewarding too, because it is an opportunity for people to innovate. And now
Yeah,
we have the tools that we can innovate with them, and they will really drive that innovation. So we actually, I think right in the new year, we're going to do an agentic workshop for nursing, where we're going to be able to bring a bunch of nurses together and just ideate around how can you potentially use these tools in your day to day. And really excited to potentially come back and showcase some of what we developed with them.
that's excellent. Excellent.
I am curious, based on what Leslie and you just said, whether you get any feedback that staff are worried
Very
that
good.
this work will end up making them in the long run take more patients or have less staff. Now, I know there's already staffing struggles across the board, but I'm just curious as to whether you hear that as feedback, because in some situations, I've heard that.
Absolutely. There's a lot of hesitancy, as much enthusiasm, there's still a lot of hesitancy around AI because there's so much unknowns around it too. So I think it's kind of the big scary shadow out there that no one quite knows how it's going to impact their role, their job. But we really want to focus on empowering folks. And that's why we're so intentional with that messaging, because we want to make people excited about AI, but it's really because we want to empower them to use it and figure out how they can use it in their day to day. So there's a couple of, I think, really nice examples. At Mass General Brigham, when we rolled out ambient documentation, it wasn't about the providers seeing another patient a day. There was no expectation that they would fill their schedules with the extra time that they had. It was really around decreasing burnout, right? That was the whole mission. It was decreasing burnout. And that's the approach we're taking here at Brown Health. We're trying to decrease the burnout that we're facing in primary care. We want to decrease all the care team administrative burnout that's just drowning folks day in and day out. So it's really, I think, being intentional about the mission behind why we're, driving an initiative forward. Obviously, there's benefits that can come, like you might have more free time to see patients. That might happen over time just naturally because you're able to just be more efficient in your day, but that's not the main goal. Also, from just I think, a hesitancy standpoint, how will it impact me? How will it impact my job? You know, there's, I think, you're seeing in industry, particularly a lot of entry-level jobs that are being impacted by AI in other industries like finance or just manufacturing and I in healthcare it's a little different. Like healthcare is really about the human connection. Healthcare, I haven't met anybody that isn't doing the job of at least two people and has any time in their day. So it's really intentional about giving them time back. Now, it will change the makeup of some jobs. Some tasks will go away just because you don't have to do the administrative work that you had to yesterday because you have better tools to automate tomorrow. But it's really around just getting people back to a baseline so that they can get back to what matters most, which is just caring for patients. And I think you're going to see jobs morph over time, but I don't see a huge wipeout of jobs in healthcare at all. I'll also say it's really short-sighted with this companies that are wiping out entry-level jobs because you're cutting off all your innovation pipeline. You're cutting off all of your future talent. And so those that are chasing short-term profits by eliminating some of these roles, they're shooting themselves in the foot for the next decade. And it's really, I think, important on us to think through how do we have a pipeline of talent that can come through Brown Health that can be AI enabled and maybe more efficient, but also making sure that those pipelines still exist for years to come. So we're being really thoughtful. That's why HR is on our governance council. That's why we have them involved on our executive oversight board, because we're really being thoughtful. We want to understand the impacts to jobs, but we don't want it to be a story about eliminating or replacement. We want it to be a story of empowerment.
The other thing I would add is the patient experience, right? So I think, I know my family has experienced it. You go to a provider now, they say, I'm using new technology, and that provider is not looking at their computer. They're not on the computer during that visit, they're with the patient. It's a whole different experience. And then the note, my provider will tell you she feels that her note is the way she originally wrote notes, and then with the change and all the time she needed to, that she didn't have for it, her notes weren't the way she really wanted them, and now they're back to the way she has always wanted to have her notes. So but I think from a patient experience, we're giving ourselves clinically back to our patients,
Yes.
right? And that was the whole reason why we all went into, whether it was nursing, physician, right? We wanted to be with our patients, care for our patients, and now we're able to give them that undivided attention instead of that computer, right, back and forth that we've seen over really the past 20 years.
Beautifully said.
Perhaps there's a could you think about or speculate about the voice of the consumer? Take something pretty straightforward in Epic. You have clinical notes that are there, and then you have clinical note summaries, and they're so far apart. And they can be sometimes almost confusing because there's so little in clinical summary, but there's a wonderful information in the clinical note. But to the average user, I think it's typically a little more complicated to understand. As you're putting this infrastructure in place, how are you getting a sense or prioritizing what your clinical consumer is interested in seeing and how, systems can be improved?
Yeah, Mary, great question, and thank you for that. So that gets into a bit about the subcommittee structure. So we have a whole clinical subcommittee that's trying to bring the voice of the clinician of nurses to the table from a governance perspective. But then what we're really doing is we're going into the department and we're saying we do these agentic workshops where we'll show you how to build an agent, but then we start to ideate with you hand in hand and say, how can this solve some challenges in your area? And we have providers that are coming up with wonderful ideas, nurses that are coming up with wonderful ideas, and then we're co-developing with them. So it's not about just saying, hey, you have to come and use this. We're actually going to the department, to the floor, and saying, hey, here's an amazing new capability. Here's how we would like to frame it and have you understand it. But then how can you potentially use this in your area? And that's where the voice shines through of our clinicians, our providers, our nurses. And that's the approach we want to take, where we are really working hand in hand to solve challenges that people are facing on the ground. And so there's a bit on the governance side, making sure that there's clinical oversight for any of our initiatives, but then the partnership that we have with the Center of Excellence and being able to go out and really start to shape the tools for the use case with the champions or the stakeholders that actually use them. That's the most powerful part of all of this.
Oh, I'm sorry. I think I wasn't clear. I mean the voice of the patient.
Oh, voice of the patient. Well, I think we will certainly have a feedback loop for any of our patients. So same thing, we will look at as we start to introduce patient facing tools, tapping into those PFACs, being able to, have a safe space where people can provide feedback along the way, being able to, thumbs up or thumbs down their experience and actually monitor that so that we can continuously improve it. So a lot of it's going to be, I think a similar approach that we're taking even with our clinicians and providers, but we're setting up those forums where patients can help inform, what we're putting out there for them, what's working well, what's not. And some of that will be, I think, based on right now, like we don't have a great uptick on my chart or we don't have great engagement prior to a visit. But if we can start really showing that these tools can introduce, a better patient journey and a better patient experience, I think you're going to start to see engagement go up, and then we'll be able to capture the voice with these tools along the way too.
I do have another question in the chat. The question is, other than Copilot, what are the other vetted tools you're using in your system?
Yeah, we have the main ones that we're using for that are approved right now. We have Copilot for business, not for PHI. We have Dragon Copilot or Nuance Stacks for ambient, so that's for the clinical side of the house. We are turning on the Epic Gen AI tools. So a lot of these Gen AI assistants with Epic, we're starting to pilot and test out. And we have a whole roadmap over the next year of where we'll be investing there. We just went live with Workday. So on the back end, you're seeing us start to investigate some of these Workday opportunities that now Workday has a bunch of native AI as well. That's another thing too. Like every company now is an AI company. So we're constantly looking at like what's being turned on. How do we make sure that things are only turned on after we've vetted them? That's why the registry is so important. But then Yeah, we're using Microsoft to develop our agents right now. So that's really using a combination of Claude and OpenAI models with Copilot. We're looking at things like clinical reference AI, and that's up to date, has new AI features that we're evaluating right now. Um, we know a lot of clinicians and providers love open evidence. We're exploring how we could potentially make that available safely in our health system. So there's a bunch in the pipeline that are being considered, but we only have a select few that are currently available.
It would be great if there were those types of references for nursing as well. I mean,
Yeah,
I know some nurses use up to date and whatnot, but from an everyday standpoint, having it available within your workflow to be able to rely upon, whether it's Lippincott, that type of content, I think nursing would get great value out of that.
we definitely will explore that.
Do we have any more questions from the folks on the line?
Not a question, but I just want to thank Matt as well and say he did us proud today. You did an incredible job of representing Brown University. So really appreciate you taking the time to spend it with us and to share all your vast knowledge, because in the short time you've been with us, you've really made a big impact on the organization already, and it's much appreciated.
Thank you, Sue. Thank you so much. That means a lot. And thank you for the opportunity to be here.
And we'd love to have you come back once you've implemented some nursing projects to
Yes.
see really, I know we're very much interested in, nursing in the loop, nursing at the table, being involved in the build, or even development, right? And knowing that nursing has a voice and that they're heard. And so I am hopeful that, in the next year or so, as you develop more content that's nursing focused, that we could have you come back.
Would love that. And thank you so much for the opportunity. Maybe even in the future, we could do a New England agentic workshop and really see if we could get some regional innovation going.